What a patient information exchange does is it brings in your electronic health record system that you might be using. It brings in your lab system that you may have. It allows a connection from perhaps clinical information and hospital clinical information. Other systems can send into it, so all of that information is in one place. One of the nice things about a patient information exchange within a healthcare system is that it's very, very quick, easy, and relatively inexpensive to install when compared to these other large solutions. It's a nice bridge while we're figuring out where we need to go. It's a nice bridge to be able to give the physicians what they need now and to make smart, informed decisions going forward. Some of the key capabilities of a patient information exchange are to allow hospitals to make changes behind the scenes without physicians needing to know or be affected by it. So when your hospital needs to do an upgrade on that level of code on electronic health record that in the past would have caused the screens to look different the next day and your physicians perhaps to be confused about where they go for information, a patient information exchange can solve that problem. The screen will look exactly the same. The patient information exchange allows physicians to set up the screens to look exactly the way they need them to look without affecting the underlying code or causing the screens to change for the physician down the hall who likes it his or her own individual way. Physicians love the customized view. They also love the seemingly single sign-on approach that they now have. So now they can go into a patient information exchange with one username and password and can launch then into all those other systems that they need to launch into, do their work in those systems without even knowing they went into a different system and without having to remember that other password. One of the biggest challenges right now as we're putting in big electronic health record systems in our hospitals is how are we going to get a hold of our old data that's in that old system and who's going to be around to maintain that data and continue to run that system, not to mention the fees that you may be incurring in keeping an old, outdated system live. When you use a patient information exchange as your data archive, you can pull the data from, again, your PACS system, your lab system, your electronic health record system, anything else you might need to have your physicians access can be all kept in one relatively inexpensive, easy to maintain archive.